Department of Health is the executive department of the government of the Philippines, responsible for ensuring access to basic public health services by all Filipinos through the provision of quality healthcare, the regulation of all health services and products.
Malaki ang obligasyon ng DOH, kaya naman taunan itong pinaglalaanan ng malaking halaga ng pondo upang maisagawa ang mandato. Nasa pangasiwa nito ang ilang mga opisina, ahensya at maging mga pampublikong ospital tulad ng Dr. Josefa Bella Memorial Hospital, East Avenue Medical Center, Jose Reyes Memorial Medical Center, National Center for Mental Health, Philippine Heart Center, National Children's Hospital at Philippine Orthopedic Center.
Mental health and well-being is a concern of all. Through a comprehensive mental health program that includes a wide range of promotive, preventive treatment, and rehabilitative services that is for all individuals across the life course, especially those at risk of and suffering from mental health disorder. Integrated in various treatment settings from community to facility that is implemented from the national to barangay level and back with institutional support mechanism from different government agencies.
Here are the support programs components of DOH. Wellness of daily living.
7 healthy habits para sa healthy Pilipinas.
Sabay handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Do it na yan, kalusugan ay unahin at mamanahin ng mamamayan. Ay healthy Pilipinas, malakas sa magandang bukas. Ang bawat Pilipino sa mundo, sa ulado ng itong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas.
All health, social, poverty reduction, safety and security programs, and the like are protective factors in general for the entire population. Promotion of healthy lifestyle, prevention and control of diseases, family wellness programs, etc. School and workplace health and wellness programs. Extreme life experience provision of mental health and psychosocial support MHPSS during personal and community-wide disaster. Mental disorder, neurologic disorders, substance abuse and other forms of addiction. Provision of services for mental, neurologic and substance use disorders at the primary level from assessment, treatment and management to referral. And provision of psychotropic drugs which are provided for free. Enhancement of mental health facilities under HFEP. Also, the community-based mental health programs CBMHP core group in the Philippines. This is a group of barangay health workers who attended the training and are willing to help spread mental health awareness to their community. This group meets regularly to learn the different topics related to mental health. They can also serve as speakers and conduct eco seminar to their barangay.
Administrative Order Number 8, Series 2001, National Mental Health Policy. The National Mental Health Policy shall be pursued through a mental health program strategy prioritizing the promotion of mental health, protection of the rights and freedoms of persons with mental diseases, and the deduction of the burden and consequences of mental ill health, mental and brain disorders, and disabilities. Administrative Order Number 2016-0039, Revised Operational Framework for a Comprehensive National Mental Health Program. This policy aims to guide all program managers, healthcare providers, various stakeholders at all levels of care in the implementation of mental health program. Aims to define the roles and responsibilities of different DOH offices, the Philippine Health Insurance Corporation, LGUs, and higher-level referral health facilities in the implementation of a comprehensive mental health program. Aims to generate support of various stakeholders in the implementation of a comprehensive mental health program in the country. Republic Act No. 11036, an act establishing a national mental health policy for the purpose of enhancing the delivery of integrated mental health services, promoting and protecting the rights of persons utilizing psychiatric, neurologic, and psychosocial health services, appropriating funds therefore and for other purposes. Administrative Order Number 2021-0012, implementing guidelines on the Medicine Access Program for Mental Health, which provided, among others, equitable access to the rational use of a wide range of pharmacologic interventions in the treatment and management of mental, neurologic, and substance use disorders.
Kasi natin ngayong umaga yung
What about?
language disorder in children. May ganun pala na nagkakaroon ng problema sa communications between children and their mommies and daddies, no? Kasama natin ngayong umaga si Miss Gila Villa Gonzalo. Isa siyang supervising psychologist at clinical diagnostic services. Good morning.
Good morning.
And what kind of treatments do you usually recommend to these kinds of children?
Usually therapy, speech therapy. Yes, speech therapy. Maganda kung mas bata, masimula na para talagang ma-develop pa
Yun nga,
siya.
minsan, consultation, they'll charge you 3,000 pesos depending on the hour that they would use up na ini-interview yung child mo. So, talagang ang concern ko kasi, of course, yung mga mayayaman nakaka-afford niya. Pero paano yung maiirap? Ano na lang ba? They just have to live with that. Wala bang foundation that could help them? Kasi after the consultation, may therapy pa.
Yes.
So, pagka wala kang pera, ganun na lang yung anak mo forever. So, that's very sad.
Yes, totoo naman po talaga, no. Medyo may kamahalan talaga yung iba kasi hindi rin ganun karami yung specialists. Aminin na din natin, ano. But hindi naman sa wala ng pag-asa kasi like in public hospitals, meron din namang mga outpatient services. Yun, sa mga government subsidized hospitals, may mga outpatients doon na tinitingnan nila doon sa mga clinics. And then, if possible, kung merong mga interventions, sometimes they can also provide.
World Health Organizations works worldwide to promote health, keep the world safe, and serve the vulnerable. Our goal is to ensure that a billion more people have universal health coverage, to protect a billion more people from health emergencies, and provide a further billion people with better health and well-being.
There is no health without mental health. That's why WHO has established a special initiative for mental health to accelerate access to quality mental health care, which respects people's human rights and reach those most in need of services and support.
It's okay not to be okay. Pero para bang it's not really okay sa ating bansa? 3.6 million Filipinos ang nakararanas ng isa sa mga uri ng mental at neurological disorder. At 88 mental health cases lamang ang naire-report sa bawat 100,000 na Pilipino. Ang tanong tuloy, bakit maraming Pinoy ang hirap humingi ng tulong para sa mental health? Here's what you need to know. Mental health matters. Ang simpleng pagkalungkot maaring mauwi sa mas malalang karamdaman. Maraming uri ng mental health problems at disorder. Pinakakilala sa mga ito ang anxiety disorders, depression, paranoia, bipolar disorder, schizophrenia, obsessive-compulsive disorder o OCD, behavioral and emotional disorders lalo na sa mga bata, post-traumatic stress disorder, eating disorder, at psychosis. Ayon sa tugon ng masa survey ng Okta Research nitong March 2021, 28% ng mga Pilipino o 3 sa bawat 10 Pilipino ang nakakaranas ng emotional problems tulad ng stress o di kaya'y lubhang pagkalungkot. Sa kabila nito, marami pa rin ang hindi bukas sa tulong para sa kanilang mental health. Ayon sa isang systematic review ng Social Psychiatry and Psychiatric Epidemiology na Filipino Help Seeking for Mental Health Problems and Associated Barriers and Facilitators, ang stigma tungkol sa mental health bilang isang nakakahiyang sakit ang isa sa mga dahilang nagpe-prevent sa mga Pinoy na kumonsulta sa mga mental health professionals.
So, malala siya in a sense na marami pa ring Pilipino ang hindi talaga informed kung ano yung mental health. It's alarming in a sense na it's affecting the people who needs mental health care. Kasi instead na humingi sila ng tulong, ang gagawin nila ay kikimkimin nila sa sarili nila yung problema nila until it's severe.
Kung merong victim blaming, meron din tayong blaming the patient. And this causes a lot of stigma. And we're just talking about the household, ha? Meron pa yan sa community. Lalong hindi magsasabi yung mga bata sa komunidad kasi nga, Filipinos have this strong culture of saving the face. Ito palang stigma na to nanggagaling mismo sa tahanan, sa komunidad.
Nakasaad rin sa systematic review na ito na naging factor sa desisyong magpapakonsulta ang iilang kaugalian at paniniwala ng mga Pilipino.
Maraming talagang barriers na kinakaharap ang mga Pilipino when it comes to seeking help, professionally man yan or with friends or families. Bukod sa structural systemic problem, isa dyan siguro yung ating cultural trait.
Ano nga ba ang behaviors and beliefs na nagsisilbing unhealthy coping mechanism ng mga Pinoy pagdating sa mental health? Una, likas na masayahin ang mga Pilipino. Nag-uugat dito kung bakit hindi iniinda ng mga Pinoy ang kahit simpleng pagkalungkot. Mapasaya lang ang kapwa, ngumiti kahit may problema, at lilipas din yan. Ang ilan lang sa mga kalimitang sinasabi ng mga Pinoy. Dahil sa ugaling ito, hindi kinailangan ng mga Pilipino ang humingi ng payo sa mga espesyalista. Nagiging indikasyon din ito ng kanilang prinsipyong maging matatag sa buhay.
Isa kasing dahilan yan ay yung ayaw natin maging pabigat sa iba. Lagi nating nasa isip yung ating kapwa that is deeply ingrained in us to the point that we are ready to sacrifice ourselves. Kaya ang pinapalabas natin, okay tayo.
Pangalawa, kung hindi ukol, hindi bubukol. Sumasangguni lamang ang mga Pilipino sa mga doktor kung meron ng malalang sintomas na nararamdaman.
Kailangan nating baguhin na humihingi lang tayo ng tulong kapag tingin natin ay hindi na natin kaya. Wala namang masamang humingi ng tulong.
In denial ang mga Pilipino sa kanilang nararamdaman. Dahil dito, imbis na magpakonsulta, nagiging coping mechanism ng mga ito ang pagpapakita na maayos ang lahat. Higit pa rito, gusto nilang panatilihin ang normalcy sa bawat sitwasyon. Pangatlo, superstitions. Sa kontekstong ito, albularyo ang unang takbuhan ng mga Pilipino imbes na espesyalista. Ang biglang pangingisay na maaaring isang indikasyon ng seryosong sakit sa utak, hindi na bibigyang pansin. Dahil unang pumapasok sa isip ng Pilipino, sumanib ang masamang espiritu. Nagiging tampulan tuloy ng tukso at mas lalong kinatatakutan ang mga taong may sakit sa kaisipan dahil sa hindi tamang diagnosis sa kanila.
Pero does that mean we have to negate the capacity of our albularyo, traditional healers, to help better a person's mental health situation? We shouldn't. We have to understand that mental health is an issue of well-being.
Ang mga ito nag-uugat sa pang-apat na dahilan: pananampalataya, religious belief, at level of spirituality ng mga Pilipino. Kung hindi man maayos ang iyong kaisipan, may gumugulo sa iyong isip at mag-breakdown ka any moment. Dasal lang talaga. O ipagpasa Diyos na lang. Yan ang nirereseta ng mga Pinoy sa sarili dahil sa paniniwalang masosolusyonan ng pananampalataya sa Panginoon ang lahat ng problema. Kaya hindi na nagagawa ng maraming dumulog pa sa mga mental health facility dahil may simbahan na bukas para sa kanila.
Bahagi din yan siguro ng kakulangan sa impormasyon ng mga tao kasi nga kulang na kulang din naman talaga yung pagpapaliwanag tungkol sa nature ng mental health and illness. May mga pagkakataon din naman na yung ating spiritual belief can actually help us. Cultural practice yun ng mga tao pero kailangan silang i-educate kung paano i-handle lalo yung mga malalalang cases.
Ang pagkakaroon ng masasandalan tulad ng pamilya at kaibigan. Ang simpleng nandito lang ako lagi para sa iyo ay nagiging first level of comfort ng marami. dahil napapagaan ang kanilang pakiramdam at nagkakaroon ng network of reliance ang mga Pilipino. Hindi na nila nagagawang kausapin ang mental health doctors. Bagamat mainam ang social support sa mental health, nagiging protective factor ito para makapag-distress at isantabi ang ibang mas nakababahalang sintomas ng mental disorder.
Kaya ang mainam pa ring approach dyan, yun nga, keep an open mind, laging magsabi na I'm here to support you, kung kailangan mo ng tulong. But of course, we don't promise anything kasi ang siguro isang that could be disappointing and could possibly be triggering sa taong nagkakaroon ng problema sa mental health ay kung nag-promise ka ng support tapos in the end bibitiw ka.
Is it helpful that we have several avenues wherein people are saying, I'm here to listen? And so the best thing to do during those times when someone is talking to you, someone is telling you what's going on, is to listen. Kung wala kang training, try not to give suggestions. Try to just listen and then provide the names, the actual names of these people, you know, the institutions where these people are from, and provide assistance in reaching out to those people.
Pero sa mas malalim na konteksto, ang mga dahilang ito ang nagiging first resort ng karamihang nakakaranas ng mental health problem dahil sa kakulangan naman ng suporta ng pamahalaan sa mental health ng bawat Pilipino. Idagdag pa ang kakulangan ng accessibility ng mga mental health centers.
Ang nangyayari, like we treat mental health like it could be just a common flu na parang okay, hanggang ganito lang yung pwedeng i-provide na tulong, when in fact mental health conditions are long-term conditions which would require long-term solutions and long-term assistance.
Ayon sa latest data mula sa DOH at WHO, sa buong bansa, nasa 92% na ang occupancy rate. Majority ng mga mental health centers ay located sa National Capital Region at mga major cities sa bansa. Napag-iiwanan tuloy ang ibang nasa liblib na mga lugar. Ang kaso ng mental health illness sa mga lugar na ito, napipilitang ikadena ng mga kamag-anak ang may sakit na mahal sa buhay. Bukod sa kakulangan sa wastong pasilidad, kulang rin ang mga mental health professionals na kayang mag-diagnose sa mga may mental problems. Meron lamang 2 o 3 mental health workers sa bawat 100,000 mga Pilipino. Napakababa sa WHO standard na 10 psychiatrists per 100,000 population. 3 to 5% lang din mula sa kabuoang health budget ang para sa mental health. Ito'y kahit pa pumapangatlo ito sa mga uri ng disability sa bansa ayon sa Philippine Statistics Authority. Nitong 2018 lang din naging batas ang Philippine Mental Health Act na layong pangalagaan ang mental health ng bawat Pilipino. Gawin itong accessible, mura at dekalidad.
This is the systemic failure of the implementation of our Mental Health Act. The problem is, do we have the budget for it? So again, we need funding to train, large-scale training of youth leaders, of school organization leaders, community workers, community health workers. We need a large-scale training for those groups of people so that they can provide support when the professionals are still swamped with other cases.
Sa tala naman ng National Center for Mental Health, nitong January hanggang July 2021, nakatanggap ang kanilang mental health hotline ng nasa 10,544 calls. Maaaring naging malaking factor nito ang pandemya. Hindi raw nakakabahala ang dumaraming tawag. Mas mainam daw ito at mas nagiging bukas na ang Pilipinong kumonsulta sa mga mental health professionals.
We also need to recognize that each individual can be vulnerable. There is no harm in saying na lahat tayo ay posibleng magkaroon yan, dumaan sa ganyan, it's a recognition on our part na malaki din yung naitutulong. Tsaka syempre, idagdag pa yung sabi ko lagi, lack of information, lack of awareness.
We have to let everyone in our society, in our community, to take part in building a society that is accepting and helpful towards the achievement of mental health.
Tandaan na mental health matters. You matter. Ako